Hi, Felix.
And I'm Daniel.
And I'm Margaret.
And this is our presentation of attrition and retention of stress and burnout of nurses in America. So, 1 in 3 RNs leave this profession within 5 years of licensure. Why is that? Why are attrition and retention of nurses extremely high and low in America? What solutions exist that solve these problems? We used a quantitative and qualitative research, which is rare among nurses, and I'm going to describe what attrition and retention are. Attrition includes actions and processes of gradually reducing the strength, efficiency, effectiveness, and numbers of nurses through sustained attacks on their character, profession, and pressure from healthcare managers. Retention is a self-evident term referring to keeping RNs happily employed as registered nurses. Nurses face many stressful issues in the workplace, which may ultimately lead to what is known as burnout. What are the causes of burnout and stress? When RNs are assigned to more than 4 patients per shift, usually have the highest rates of burnout and stress. RNs who work longer shifts, 10 to 13 hours compared to other RN shifts, can also lead to exhaustion and stress. Nurses also face many different work-related issues, such as dealing with death, the emotional strain of losing patients, and assisting grieving family members may become overwhelming. Also, the increasing use of technology. Some of the solutions nurses can apply for burnout and stress include support groups such as therapy, reducing job-related stress, getting assigned less patients, and training for technology equipment. The quantitative research was conducted by Semiotti. He studied the urinary tract and surgical site infections, which he used a linear regression analysis and multivariate model by showing the patients of nurses experiencing burnout had an increased incidence of urinary tract and surgical site infections. The qualitative research also conducted by Semiotti demonstrated that supervisors showed negativity toward RNs who reported work-related stress. Semiotti also used a cluster analysis which showed what hospitals enhanced burnout and stress, which are enhancing the workplace security, mutual respect, and an increase in positive feelings.
Burnout is a syndrome resulting from chronic job-related stress in a workplace, which often occurs among critical care nurses. Researchers have reported 3 dimensions of burnout. These include emotional exhaustion, depersonalization, and a loss of sense of profession efficiency. These dimensions are the starting point of nurse burnout. 35 to 45% of critical care RNs experience burnout symptoms. These symptoms include constant fatigue, becoming insensitive, lack of enthusiasm about work, feeling overwhelmed, and they also dread going to work. Critical care registered nurses are at risk of burnout due to the complexity and the pace of environments they work in. Consequences of nurse burnout in critical care units include increased job turnover, reduced patient satisfaction, and a decrease in quality of care. As you can see, the picture to my right shows the full circle of nurse burnout, which starts with nurse burnout, which leads to nurse turnover, a nursing shortage, then inadequate staffing, which then leads to job dissatisfaction. They both affect patient care, patient safety, and the quality of care. Psychological stress begins to develop when one's external demands exceed their adaptive abilities. Stress of a critical care nurse include high patient morbidity as well as mortality, challenging daily work routines, regular encounters with traumatic and ethical issues. Critical care nurse managers, medical directors, as well as other unit-based administrators need to be aware of the widespread presence of nurse burnout. Prevention of nurse burnout is important. Some of these factors include resilience, self-care, recognizing triggers, and also having a strong coworker relationships. Palliative care is an approach that improves the quality of life of patients and their families facing problems associated with threatening illnesses. Palliative nurses experience burnout when faced with too many work hours, poor responses from patient treatment plans, short life expectancies among their patients, and their burnout rate is over 62%. Nurses experience rapid evolving situations, so they have to stay on their toes.
For disease control and prevention defines long-term care facilities as facilities that provide a variety of services, both medical and personal care, to people who are unable to live independently. According to the CDC, 1 to 3 million serious infections occur every year in nursing homes, skilled nursing facilities, and assisted living facilities. So there's a lot of infection happening. So why is that? Well, high levels of stress in long-term care facilities may result from excessive workloads, paperwork, and from strict regulations. So these long-term care facilities are more likely to have patients with health problems that may create staff or stress for staff, such as patients that are disabled, patients that are agitated, and also there's problems like dementia in the older population. So more patients are required when working with these types of people, and that also can lead to stress and burnout if there's enough patients on the nurse's part. So care staff in long-term care facilities are usually under great physical and emotional demands because caring for patients with dementia is time-consuming, and symptoms of dementia, like aggression, will lead to increased stress, burnout, and negative attitudes or less empathy in nurses. So if not managed, this burnout will lead to cynicism, which is where nurses will go to work just to follow their rules and do their job, but they won't really understand the patient's individual needs. And that's not a good idea in this profession, because nursing is really focused on patient-centered approaches. And if the nurse is burned out, then they won't be able to deliver that type of care. So Kennedy explains how strategies for preventing stress and burnout among long-term care nurses includes stress management programs, education, a positive work environment, evidence-based practice, and giving employees more control over their work hours. So they explain how stress management programs can include things like exercising, resting, a proper diet, and nurses can also develop groups among staff, such as walking groups, so that they can use this to find the motivation and confidence to do stuff like exercising. So evidence-based practice allows nurses to use findings from research or conduct their own studies so that they can find the best possible solution to a problem. So for example, they can use pilot projects, so they can do their own studies, or they can also use current evidence-based practice so that they can find these solutions to these problems. Other things that nurses can do is giving employees more control over how many hours they work. That is something that's being more practiced. Nurses are commonly working more 12-hour shifts today compared to the traditional 8 hours. When it comes to working long hours, nurses may be choosing to sacrifice work satisfaction for benefits in other spheres of life. So for example, they may be working long hours every day, but then they get more days off, and they will have, to them, they have more time, more free time to do stuff that they want. However, this type of choice is likely to compromise nurses' recovery, sleep, physical, and psychological well-being, as they may need more recovery time despite working less days. So there's a trade-off there. And also, nurses are more likely to leave the job when they have worked shifts of 12 to 13 hours. So educating nurses on these findings can help bring greater awareness to nurses so that maybe they can try and implement strategies in their life so that they can reduce the chances and reduce any stress and burnout they may be having. So at the beginning of our PowerPoint, we said that our question was, why are attrition and retention of nurses extremely high and low in America? And what solutions exist that solve these problems? So for solutions, our research would include following 2 groups of nurses in a certain setting, whether it's palliative, critical, and long-term care. All 3 experience stress and burnout, as you saw in the data that we showed. So one group would be the controlled group, and another group would be the experimental group. So the experimental group would be the one where we would perform the intervention on, but both groups would be interviewed prior to starting the research so that they would be asked questions on stress and burnout beforehand. And then we could hold a seminar on the experimental group, which would be our intervention, and they would be educated on the research that has been performed, such as the things we have discussed in this PowerPoint. So showing them what the evidence-based research says in terms of stress and burnout, strategies they can do to improve it, what the research says about work hours and things like that. So we would follow both groups for a period of time and then interview both groups at the end again to see how now they feel once one group has gotten that education. So then we can look for changes and see if they're experiencing less burnout. So we would evaluate the results and determine what the data says. So for example, if the seminar done on the experimental group changed their perspectives on burnout, or if they felt less burned out now once they implemented those prevention strategies such as exercising more. And that's our study. So that's going to bring us to the end of our presentation. Here are our references, and thank you for watching. Bye, everybody.
Bye. Thank you. Bye.